we made these problems, Marlon. I know you and me agree. This culture, this society was constructed on some really difficult things that aren't true. That women can't be president, that black people aren't as cool as white people, that fame is merit, that wealth is value. These are the messages of our culture, and they're not true. In fact, they're dehumanizing and harmful, particularly to young people. So we have to see them for what they are, which is a social construct. Now, they're deeply embedded, they're multi-generational, they're sustained by incredibly sophisticated actors, but we can't ascribe to them the power of like the natural universe. They were constructed by us. They must be deconstructed by us.
We already know what helps. Connection is the cure. It's our deep and meaningful relationships that give us hope and healing. Welcome to This Helps. I'm Marlon Morgan. Join us as we practice authentic and vulnerable conversations that inspire us to go deeper with the people in our own lives. Alex, so glad to have you on today.
Oh, thank you, Marlon. It's great to see you. A pleasure to be here.
Hannah, do you have some information that you can tell us about Alex?
Absolutely. We are so excited to have Principal of the Public Works Alliance, Alex Briscoe, with us today. He previously led the California Children's Trust and served as Chief Executive of Alameda County's Healthcare Services Agency, where he oversaw a $1 billion budget and helped expand access to youth mental health services. A longtime behavioral health leader and advocate, Alex's work sits at the intersection of public health, education, and social justice. He joins us today to share the importance of youth mental health support and how we can improve the well-being of our youth.
Alex, what's a good day for you?
Well, first of all, I got to say, recovering bureaucrat and defunct therapist will do fine for an intro for me. But, oh man, my kids just left the house for college, so I think it's changed. A good day for me is probably surfing or going to the gym, reading a book.
Did you just look up coolest answers possible? Is that what we're dealing with? Where are you surfing? I know you're in the Bay Area. You heading out to Mavericks? What are you doing?
I have a nickname in my surfing community. I'm called Small and Sunny.
Oh. I think we need to get into that.
You know, I like my adrenaline, friend, and I played a lot of sports in my life, and I learned quite a bit, frankly, about race and connection and all sorts of things, identity, gender from those experiences. But yeah, I like my adrenaline in small chunks. I like to be able to walk the next day.
Speaking of adrenaline, a bad day, I guess, would be like have you seen a shark in person?
I have, but I kind of put that aside. The way I figure it, you know, it's actually, again, a good parallel to like, you know, safety network or working in low-income communities. There's just so much like framing and fear-mongering. Doesn't actually reflect the truth of any of it.
You didn't hear, that's what we're here to do. I'm here to focus on what's negative and scary, and then you have to like get me out of it. That's the whole hour.
Well, Marlon, we've connected many times, but like one thing I know we share is like this belief in the beauty and wisdom of young people.
That's true.
Yeah.
That's true. Well, I think that, you know, you do have a lot of great experience, but one thing that I've always loved about talking with you is I've never thought small, but I've always thought sunny. I feel like you have brought hope to just about every conversation we've been in. You've also brought a level of authenticity and even vulnerability. You mentioned earlier, we've been able to talk on panels together and get to know each other. And anytime you find someone who's committed to the same general ideas that you are, and also I think committed to those ideas over and above, hopefully, if we keep each other honest, we're committed to those ideas above even ourselves and know that we're part of something bigger. That's always been something I've enjoyed about you.
Thank you, Marlon. Right back at you.
How'd you even get to this point that we're at? We're reading your bio. So much has happened.
Well, I'll go back to the beginning or beginning-ish, you know?
Yeah.
In the community I grew up in Philly, I didn't know it, was the first free Black community in America.
I didn't know that either.
Yeah, South Philly we actually squatted me and some buddies, some friends, squatted in an abandoned community center. And it happened to be the community where W. Du Bois wrote the history of the American Negro.
Wow.
We didn't know none of it. We didn't know none of it.
Whoa.
And we started fixing up abandoned houses with kids who dropped out of high school. and we became the second youth build in the country, literally the second one. And we also became the first charter school in the state of Pennsylvania.
The second youth, what would you say?
Youth Build. Youth Build is this beautiful program started by Dorothy Stoneman in New York, where young people who 18 to 24 who dropped out of high school return to, rehab abandoned houses with homeless families while they get their GED or high school diploma.
Mm-hmm.
And I just learned so much. I mean, I was like very close to the age of the young people in the program, but I learned about how brilliant young people were. Given good information and enough money to meet their needs, they'll kill it.
Mm-hmm.
And then also on the social justice front, I learned how important it was to produce revenue.
Yeah. You can't do much unless you have the resources.
So I did that for a while. We became literally the first charter school in the state of Pennsylvania. And then I moved to California and got a master's degree and started working as a therapist in the Oakland public schools.
Tell us about that move. What got you across the country?
It's a great question. I moved back to Philly to take care of my mom who was dying of cancer. And I think we all have complicated relationships with our hometown,
Mm-hmm.
And I was very proud and I loved my mom, and it was a privilege to take care of her. But, I didn't love my hometown. It was like, well, that's where I got arrested. That's where she broke up with me. That's where I got beat up.
Right.
As soon as I had a sort of, chance to look, my brother was living in San Francisco. So I moved there, and it just seemed cool, man. The ocean was right there,
Mm-hmm. So it was partly the whole vibe of the Bay Area that you were like, yeah, this works for me. It's far enough away from where I got beat up and broken up with. So
yeah. I think that's true. And I would say also just, I think we all kind of, reinvention is one of the great, joys of young adulthood,
Yeah.
And
Yeah.
I got to do that.
That's awesome. Yeah. Especially sometimes a geographical move doesn't allow for that because we take so much with us. And sometimes it is exactly what we needed to have a new start.
Yeah. it's actually a good story. On the anniversary of my mother's death, I go to an ecumenical service. Like it's, and I've searched for God, haven't found her or him yet,
Mm-hmm.
but I know there's something out there. So I went to the service at the Unitarian Church in Oakland.
Mm-hmm. This is back in the day?
This is 1990, I don't know.
In the 1900s.
Yeah, right.
The late 1900s.
Yeah. So at the end of this service, they read this story by Franz Kafka.
Mm.
And here's the story, real distilled.
Mm-hmm.
A guy dreams of a door behind which everything he hopes rests. But standing in front of the door is a colossus of a man blocking the way. And this man sits down and tries to figure out a way past him and spends the next 30 years trying to figure out a way to get through the door.
Mm-hmm.
And as he starts to die and he's drawing his last breaths and he motions to the colossus and he says, "Hey, what was the answer? How could I have gotten past you?" And of course, the man says, "You didn't need my permission."
Wow.
And so this, I guess, pastor or leader, or whatever it was, said to everybody in the room, "Imagine a door behind which everything you dream rests. Go through it. Don't wait for anybody's permission." And on my way to that service, I'd driven past this high school in Oakland. I literally made a wrong turn on 27th Avenue. And the windows were broken. There was razor wire, complete with the kids smoking a blunt on the steps, the whole thing,
Mm-hmm.
And so I went home and I looked up the name of that high school and I emailed the principal. And I said, "Hey, I got a master's degree. I need to earn my hours. What's up?" And that led to a relationship where this is a high school that had one of the highest dropout rates in the nation. Like only 1 in 5 freshmen completed. And,
Wow.
Googling around, I found at the time that they were eligible for funding they weren't getting. So I helped them get the money and they used it to hire me. And that's where I did my training. That's McClymonds High School in West Oakland, an extraordinary school, an extraordinary community of amazing people who I owe a lot to.
Yeah, that is an incredible community and school. I think we've had the opportunity to work with some folks over there.
Yeah.
You've done a lot of what you just said, and it sounds like you started by helping people get the resources they needed and then actually helping to provide the access that they needed. I'm almost wondering how you knew that there was this money. Like, what's your secret to making that work?
And this is what, made me into a bureaucrat, even though, I trained and wanted to be a therapist. is the internalized oppression of the left is you're not allowed to have a good spreadsheet. You with me?
I can't argue with that.
Just there's so many examples in our space, Marlon, of pretty Christmas tree ornaments hanging on a dead tree.
Mm,
That beautiful program or that thing. And I've always been kind of drawn to like, what's the structure of it? How come it works this way?
mm.
And if we're going to fix it, let's fix it at scale, bro. Like,
Don't just fix it in one place.
this is what led me to Medicaid and led me to the Youth Behavioral Health Initiative and led me to the multi-payer fee schedule, right? All of that.
Our listeners get a wide variety of people, very smart and inspiring people. Some of these things I'm going to have to stop you because you and I know what those are. But
Yeah.
I think part of what I want to do today is make sure that as many people as possible who listen to the show know what each of those things are. I think we could take the rest of the time probably, and
Yeah.
hopefully, I've heard it explained in the most engaging way from you, so I think you're the person to do it.
Well, one step back.
Mm-hmm.
I worked as a therapist in the Oakland Public Schools.
Mm-hmm.
I worked for Children's Hospital Research Center at Oakland, high acuity, difficult circumstances.
Mm-hmm.
Then I worked in foster care, juvenile detention, and then I led this large health system where, I had to make payroll with thousands of employees. And so I learned my kind of public sector reimbursement, not in grad school, man. Like I learned it trying to get the ambulance there on time and keep a very big system operational.
I don't even know that there is a grad program that can teach you how to meet, basic needs so that you can actually meet the other needs on the Maslow's hierarchy.
Yeah. And what I learned from all that stuff is, got to get your hustle on. And like, my mentor in this work, Vanna Chavez, who passed away, she went to work for Alameda County when women weren't allowed to wear pants to work.
Oh, wow.
Did not have a college degree. Okay. Grew up in Hayward, and was the finance director for a multi-billion-dollar health authority. She once put her finger on my chest and she said, Alex, you have to hustle as hard for federal matching funds as poor people do for rent. The number one truth of the fight against injustice or to prevent preventable human suffering or just to address, I've seen a lot of suffering, friend. I know you have too. Like I have seen a lot of children die. I have seen a lot of really difficult things. And I think one of the ways I have been able to hold that or manage it in my life is to work really hard and try to be smart and try to fix things at scale.
That's, it's a brave thing to do, especially knowing what a bureaucracy can have in store for that kind of dreamer, passionate person. I do think in every room I've been in with you, your energy has not been surpassed. And it does take that kind of commitment to even think you can make a difference in systems that are really meant to withstand change.
Yeah, it's true. That's well said and point well taken. And when we start talking about young people in schools, we'll get deeper into this, but we made these problems, Marlon. I know you and me agree. Like, this thing that we live in, this culture, this society, was constructed on some really difficult things that aren't true. Like that women can't be president, that black people aren't as cool as white people, that fame is merit, that wealth is value. These are the messages of our culture, and they're not true. In fact, they're dehumanizing and harmful, particularly to young people. So we have to see them for what they are, which is a social construct. Now, they're deeply embedded. They're multi-generational. They're sustained by incredibly sophisticated actors. So it's a difficult, very difficult challenge. But we can't ascribe to them the power of like the natural universe. They were constructed by us. They must be deconstructed by us. And only government can do it. Like, only government can finance it. So that's actually a really...
Yeah, that was the part I was going to ask you to clarify, because I think there's so many people with you hearing everything you were saying. Like, yeah, Alex, this guy rules. and like, this is so true. We don't have to accept this. This is lies meant to keep people in power that want to stay in power. And then when he said only government, I heard like a record. I don't know if Andrea, our producer, can add a record scratch in right before you said only government could do it, but that's what I heard.
Great point, brother. So like, let me say, oh, good one.
Thanks, Andrea.
Yeah. Well, let's just do let's go a little bit down this rabbit hole. So
now we got to explain it, because I understand. I think I understand what you are saying, and I think that you have a great case for why it's true. So I'd love to hear it.
Well, I'll just do the one that you and me are working on so much right now.
Mm-hmm.
Medicaid.
Yes.
In California,
mm-hmm.
is $170 billion program.
Wow. To put that in context, I mean, that's close to what, half of the budget here in the state. I mean, what are we talking?
Yeah, I mean, healthcare in general is
mm-hmm.
20 to 25% of GDP.
Right, like a fifth of every dollar.
Yes, yes, and so you could bundle all of the grant making of every youth and health related philanthropy in all of California.
Mm-hmm.
You might get to 500 million, maybe.
Mm-hmm.
And that was like a couple months of my budget.
Yeah.
So, and to be frank, Marlon, this is what I would invite, particularly young people and grad students and other people who are getting into this space, is like, see, why do we prostrate ourselves at the feet of privilege to solve the problems that privilege created? I mean, and I'm personalizing it now, so I don't mean to demean or diminish any of my friends who work in philanthropy or the foundations that give me money.
Alex, you can say anything you want. People need to hear this.
Yeah. Like most young people, when you say, hey, you got a cool idea to do something right by other people, they say, I want to write a grant. And what I would say to them is like, hey, man, unpack how your public school is funded.
Mm-hmm.
Learn about expanded learning opportunity program. What's 21st century?
Mm-hmm.
Like, you know how free and reduced lunch works?
This is going back to only the government can provide what we need to get out of this mess.
400 years of free got us to where we are right now.
Mm-hmm.
And so to unpack it is going to take a massive investment, a massive change in how we negotiate the social contract.
Yeah.
To execute it is going to take billions of dollars of investment. And there's only one place for that.
The government.
Yes. Now, the good news is the role of government is changing.
For most people, that's bad news. They think it's bad news.
That is changing.
Mm-hmm.
Well, this one I think is actually good news. Well, particularly for our work, which is government has historically provided things for people. They've delivered things.
Mm-hmm.
But particularly when you look at healthcare, less so schools, okay? Though you're breaking that down. In healthcare, government is becoming a purchaser, not a provider. Are you with me?
Yeah.
Their community-based organizations and not-for-profits are increasingly doing the work that 50 years ago was done by civil servants.
Mm-hmm.
And a great example I'll just use in Alameda County, we started 240 programs in schools, including 30 federally qualified health centers.
Wow. And for those who don't know, that's an incredible amount for one area.
There's a full clinic, like lab, pharmacy, everything, in every middle school and every high school in Oakland.
Yeah, I don't think most people know that.
That wasn't done by hiring county staff. That was done by partnering with La Clinica, with Briscoe, with Lifeline, with Children's Oakland.
Mm-hmm.
And there's a number of things driving this change from provider to purchaser. The first is the financial incentive. It's too expensive to hire civil servants.
It is. You have a model that is based on 50 years ago, and a lot more tax dollars,
and a pension you got to pay, and a benefit load. It's like 30 to 40% more to hire a county staff member than it is to hire a community-based organization. So one is there's a real financial incentive driving it, unmet pension obligation, et cetera, et cetera.
Yep.
Second, well, there's three. Second, it's difficult to innovate in the context of collective bargaining and labor. Like, new stuff is hard to do quickly and at scale.
I would say it's actually de-incentivized to do new stuff in the
Absolutely.
public sector.
Yeah. And then third, and again, this is hard stuff to talk about right now because of the federal administration, but you got to find folks who look like the people you're trying to serve.
Mm-hmm.
We know from 50 years of research from cancer and heart disease that when the treating professional shares your lived experience, health outcomes are always better. And I found as a purchaser, as a big public system, in a county where most zip codes were dominated by people of color, that I needed to find providers who reflected the community we served. And I couldn't do that through traditional civil service lines. So I think those are the three things that are driving the shift of government from provider to purchaser.
And you think people, like you mentioned some community-based organizations earlier, they're either more motivated or have an easier time finding people to serve communities that reflect the communities they're in.
Yes, there's these operational barriers, collective bargaining, pension
Mm-hmm.
obligation, cost.
Mm-hmm.
But then there's also this, I think the positive side of the flip side of that is that you can find relevance
Mm-hmm.
And trust and alliance. And, I know you've heard me say this, Marlon, but it doesn't matter how good a therapist you are if a kid doesn't want to talk to you. So like,
It's true.
yeah.
It's true. I think we're programmed to keep ourselves safe. And if we think a person who looks one way is safer than another, then that continues to keep us isolated and unsupported.
Yes. Yes. Like, give me trust and alliance.
Mm-hmm.
Everything else can be built.
Yeah. And I think some of those studies you mentioned, there's so much wisdom behind the science. I think we have always kind of known. I mean, if someone is in a situation that is objectively unsafe or a dangerous community or one that has a lot of violence, and there's someone who looks like me and I know that they understand my life, then they also have some skin in the game. They know what it's like. They know what those pressures are that I'm coming to. You almost have to do a lot less therapy and talking and more being there and being consistent and just kind of walking through it together. You can't walk with someone to a place that you've never been.
I think a risk in our space, Marlon, is like this kind of rush to the medical model or the pathologizing of young people's experience.
Let's get into that, Alex. You mentioned that we've sort of created an environment that you described. I think Gabor Mate, one of my favorite authors, calls it just a toxic culture. When you said fame equals merit, you said that sort of, skin color is worth, all these sort of rules that we think are rules, or we even, some of us sadly, think that they're truths. And none of it is. And you mentioned it's all a construct, almost like, and it's terrifying. It's terrifying to think that what we're basing our lives on is a collective agreement, especially if it's wrong. In my mind, I think about the fact when I have $100 bill, the only reason that's cool that I have that is because everyone else has agreed. But even money itself, that's one of the scariest ones. Like if everyone woke up tomorrow and just said, it's just paper. Get out of
Yeah.
here.
Yeah.
Like none of this would work.
Yeah.
And we have the power, actually, that's in our own minds to start to change that, especially if we do it together. But so the culture sucks. It's leaving our kids lonely and depressed and anxious, and harvesting their attention. Where do we go from here? Medical model? Why doesn't that work? Why don't we just take them to the doctor?
Let's go back to the first thing we said,
Yeah.
Together. Why I'm always so anxious to be with you in these conversations, despite the fact that there's never been any money or financial relationship between us over
That's
many.
true. That's
Yeah.
true.
Is that young people are awesome, and I'm about to tell you the horrible numbers that you know well. But despite all of the human suffering I've seen, and I'm not romanticizing it one bit, there are so many young people who I wasn't sure if I was going to see them, how, or if I was going to ever see them again. And they showed up the next day with a smile on their face and made my life better. Like, the human spirit is beautiful. It is resilient. But we put these toxic messages that have existed well before social media, but we put these messages in the eyeballs of our children in 2009 when social media became available on mobile platforms.
It's an amplifier. It's
Yeah.
just you can't tune it out.
No. And we did it unintermediated. Like kids are seeing this stuff on their screen alone, where you and me got that stuff with mom and dad at the kitchen table over the newspaper or with a teacher. Like if you're a kid now, you're seeing images of school violence.
Yeah, and you're by yourself. And if you hear that and you're by yourself and you cry, it doesn't matter.
Yes.
How sad is that?
Well, what happens is the symptomatology appears to be a behavioral health condition. You know, when you and me, right? Like,
yeah, but I think hopefully everyone just heard what you said, and that is a symptom of reality is not a behavioral health condition.
That's exactly the point. Like, if we rush to pathologize this experience, we are imprisoning young people in a reasonable reaction to the culture we created.
Yeah,
So,
and we perpetuate, we prop it up.
So you asked me, what do we do? And I would argue there's no going back, okay? We have to teach young people at a very early age to discern, to resist, and to find community and connection outside of the digital space. Like, and if you do those three things, young people will kill it. But if you say, no, you're broken or pathological, and you don't teach young people how to resist these messages, they will see them as real and they will internalize them.
Well, you don't give them any other options.
No. And to incredibly destructive outcomes. Let's just do this for your listeners so they know.
Please.
Between 2007 and 2017, so the decade before the pandemic, we saw a doubling of inpatient admissions for self-injury. That means literally 104% more kids had to be admitted to the hospital because they hurt themselves so badly.
But Alex, you're saying COVID didn't cause it?
COVID made it 27% worse. So, right. No, COVID didn't cause it. We did. This toxic culture, as I think you were inviting me to say, Marlon. Thank you.
I was.
Yeah. Yeah. So don't believe the hype. COVID didn't cause it. Now, COVID made it a lot worse. Now, again, for people who want to geek out here for a second, differentiating between self-injury rates and suicide rates is really important because suicide rates skew white rural boy.
And why is that, do you think?
Access to a gun, a screen, and isolation. Now, when you look at self-injury rates, they track to the negotiation of difference in our culture. Girls hurt themselves more than boys. Black kids hurt themselves more than white kids. LGBTQ kids hurt themselves more than straight cisgender kids. Like, so all of this is leading us back to this like thing that we cannot deny or ignore, which is that we have constructed this toxic culture that Dr. Mate speaks to. We now must teach young people how to survive and thrive in it. Mental health is a great tool, but not the medical model.
Yeah, because it almost makes it worse that they're like, yeah, I'm anxious because the world's clearly burning up. And then you're telling me I'm anxious? I'm an anxious generation?
Right.
What? Yeah, maybe you weren't anxious enough, guys.
Yeah. But so let's give your listeners some specifics. When we say break the medical model, okay? Because I know you do it for a living. I do it in the policy realm in California now and multiple other states. What we mean by that is remove diagnosis as a prerequisite for care.
Yeah, most people don't know that. But, since over the last 50 years or so, in order to get care, and it makes some sense in order to have a system and to have insurance, which not everyone agrees is a great system, but it is the one we have, you have to label a kid with a diagnosis.
Yes. And I sometimes joke when I'm talking to rooms full of therapists, there's no one in this room who's billed more adjustment disorder not otherwise specified than me.
Yeah, because for people who don't know, that's sort of the lightest touch, the most confusing amorphous label that you can give, and that's we think, okay, well, if we got to do it, that's how.
But, I'm happy to report, Marlon, because of work that you and me have done over the last 3 years, you can now bill Z65.8.
Tell us about that. It sounds like the most boring thing in the world, but it's actually the opposite.
California made some groundbreaking changes. You can now qualify for access to mental health support.
What does that mean about me, Z65?
It basically means that you have experienced discrimination, you have housing instability, you have food insecurity, or you had one of the adverse child experiences that Dr. Nadine Burke Harris's work has repopularized. What it basically is a way to code social and emotional support not tied to pathology, but tied to this stuff we've been talking about.
To tie it to the objective issues that we're experiencing, the kids are experiencing. And we're not sort of blaming them and saying you're anxious, but we're saying your situation is challenging and painful, and we're going to acknowledge that. That's incredible that itself has been able to change.
And it's going to take us decades to change the culture of like, sit down on a couch and let me analyze you. And for us to, hire a lot, train up, which leads me to my second most important piece of how you break the medical model. You change access criteria so they can reflect what's actually happening.
Mm-hmm.
And then you reimagine the workforce.
Mm-hmm.
And you're right at the heart of this, Marlon. It's something I've always loved about the work of Wellness Together. Just there will never be enough therapists. And thank God. Because with all due respect, 70% of them don't look like the 80% of kids on Medicaid who are kids of color.
There wasn't enough when we started. There still isn't enough. And there's two points that I would make there. And that is, one, I go to a lot of, there's this whole notion of for-profit mental health. And a lot of it, I think people have convinced themselves that it's actually better than nothing, or it's helps to kind of put a screen back in someone's face without giving them a human connection. And I think that saying there's not enough people of color in the social sciences or in psychology or in counseling, and then saying and the idea that I have is to just simply give them another screen or a phone. I mean, no one's going to do that with their own kids. It's a good business model because it makes a lot of money, but it does not help our kids to give them more of the thing that's hurting them.
No, I agree. I mean, practically what this means is you have to reimagine who does the work and who gets paid to do it.
Mm-hmm.
And the mechanics of that are the new provider classes that we've gotten approved in Medicaid over the last 2 years. So those are community health workers,
mm-hmm.
certified wellness coaches, certified peer counselors, and doulas.
Mm-hmm.
Those are 4 new types of provider who can bill behavioral health that don't require traditional licensure.
You just mentioned 4 more doors that are now opened up to people in a community that can serve their community.
I'm just thinking about back when you were a school counselor, Marlon, you and me have both been in this. Like, I've started tons of school-based peer-to-peer programs because
mm-hmm.
you find your charismatic adolescent, teach them about sex, drugs, and life, and have them talk to other young people. It works great.
Yep.
But when I would say to that young person, you're so connected, you're so smart, man, people love talking to you, you should be a therapist. That young person would turn to me and say, therapist, master's degree? I'm going to be dead by 30. Get out of my face.
Mm-hmm.
And what we're now saying to them is, you can graduate high school and become a certified peer counselor. Then you become a CHW. Then you can get an associate's degree and be a wellness coach, and a bachelor's degree and become a wellness coach too.
And the whole time you're making some money, you're able to support yourself. And that's so different than how the model was before you started this work, Alex, with the state, and became, kind of helped us, and we're still becoming a leader for other states and programs. But it used to be the only way that you could get a master's and become a social worker or a licensed therapist in California is if you took out, I would say, either had a lot of money or borrowed a lot of money. And then on top of that, you worked for free for like 3,000 hours. And not only that, but for every 10 hours of those 3,000 hours, you paid another clinical supervisor $100 to tell you what you were doing was okay or was not okay, and to guide you through it, which actually, clinically isn't a terrible system, but financially it is a system that is inherently discriminatory, and we're working to create models that are the opposite of that.
Yes, beautifully said, Marlon. The tension is you have to build the model while you generate the reimbursement policy and practice to sustain and scale it. And that's the kind of magic, is without the hard work of writing new welfare institutions code or new state plan amendments and creating billing and scope of practice guidelines, without doing all of that work, then you just got another pretty Christmas tree ornament on a dead tree.
Ugh.
Like,
Yeah.
and so that, I think that's where, when I first heard about Wellness Together and sort of the work you were leading, I was just so fascinated by it because it was connection. Like it identified the fact that kids 8 to 18 almost never go to the doctor, but that's when 75% of mental illness manifests. So you need the healthcare system when it's least available for mental health.
Right. And you have the least agency to go get what you need.
Yeah. But the idea of just drop a therapist in a room at the end of the hallway who sees 20 kids at a time and may not look like the kids they serve, and that's not the way either, even though I've paid for a lot of those.
That used to be the only option you had.
Yeah. So I think there's this kind of revolution in so in order to make that work scalable that you pioneered and developed, we had to create an investment vehicle, the Youth Behavioral Health Initiative, a multi-billion-dollar investment.
So now we're talking about the California Youth Behavioral Health Initiative. Tell us just generally what that is. If someone's never heard of it before, I've heard you do a great 2-sentence pitch.
I mean, it was a $4.4 billion investment in reimagining how we support the social and emotional health of children.
Mm-hmm. And you've been at the heart of this before, during, and after. Yeah.
And it's tied to a lot of Medicaid stuff. So if Medicaid makes you throw up in your mouth a little bit or whatever that, thing is,
we'll have another whole episode on that. It'll be a bonus one that we pay them to listen to.
Right. It's going to Medicaid is actually sexy. You just don't know it.
Yeah.
Right? But one of the things this package of reforms did, which is really important, is it said, what ifs, and not only what if, because we've now made it law in California. Mm-hmm. What if we made schools automatically in network for all managed care plans?
That's revolutionary. It really is.
It's a pretty simple idea. 96% of kids in California have health insurance. And health insurance has to abide by a set of laws. And one of them is, if an essential service is delivered, like an emergency department, the health plan has to pay for it. That's why your health insurance works when you go on vacation, right? Mm-hmm. That's called portability. Mm-hmm. And what we did is we said, what if we made schools the same as emergency departments for 52 codes around mental health? And what if we said, okay, if these are delivered in a school by school staff or a provider that they say is mine, every health plan has to pay that. No questions asked, no copay, no prior authorization. Basically. And that is what California just adopted. And I think it's fair to say the implementation is a show.
Okay, well, I want to, in the transcript, that was Alex that said that.
Yeah. As all big things are. Okay. Mm-hmm. To be fair, like I say that with great generosity of spirit, mm-hmm. We just made perhaps the single biggest policy change in the history of youth mental health.
Yeah.
We said if you get a mental health service in your school, your health plan has to cover it.
And not to make excuses for anyone, Alex, but I think the show point is well taken. It also, what did we expect? Because the systems that we're now asking to do even better and make changes are the same systems that we had. So I think, anyone who's willing to step into that arena is going to, like anyone making changes, it's going to be hard.
Yes. But it's also super exciting. Mm-hmm. Because what it says to everybody, to health plans who want to operate in the largest economy in America,
sure,
uh, to whether you're in Medicaid or you have commercial insurance. We're saying schools are just as important as hospitals or ambulances or doctors' offices to the future of youth mental health. And they must be legitimated in our reimbursement policy and practice if we're ever going to address these striking numbers we talked about earlier.
Thank you for doing this, Alex. How long has it been since you started working on this to get to this point?
I mean, I go back to I worked in a high school
Mm-hmm.
and I learned how to bill county mental health departments and, sold Snickers in the parking lot, whatever.
Mm-hmm.
And I know instinctually, as you do, my friend, why that there is no other pathway other than schools. Like, there's no other way. Like, the
No.
only way to.
It's the one that exists. It's the one that we have. It's the only real safety net in the country.
But we'd always engineered around the edges of the financing.
Yeah.
This grant or this piece of legislation or this thing. And I feel like I spent 30 years playing in this space, funding big hundreds of millions of dollars a year in 240 schools. And it just struck me that we never swung for the fences with a solution that was scalable. And to be frank, I needed Secretary Mark Galley, pediatrician, a courageous man who'd worked in safety nets for many, many years. I needed him. I needed Governor Newsom. I needed Director Bass. I needed Autumn Boylan. I needed Sohail Sood. I needed Nadine Burke. I mean, we needed there was a confluence of opportunity with extraordinary leadership. And let's not get it twisted, y'all. We had $100 billion surplus.
Well, this is if you're going to do something with it, youth mental health, especially in California, where arguably most culture, our biggest export is culture. When it comes to electronic media and everything else. So for us to be part of the solution makes a ton of sense. And to steal a phrase that I heard Governor Newsom say more than anything else during COVID, you took the time and you met the moment. And we are still doing it. We support you and love the fact that you did something. I mean, these are just at its heart. These ideas like this, these $5 billion ideas, these ideas that change kids' trajectory of their lives in the largest economy in the country, these ideas come from people who are passionate, who have a past, who have experience, who have the knowledge and the willingness to do it. It's not an easy job. You don't get rich. It's the purpose behind it, the meaning behind it is, why I would imagine it's the only thing that kept you going at certain times. And we just want to thank you for it and thank you for explaining it. The thing that helped me the most, the thing I didn't have before this conversation, was the solution to when I talk to my 11-year-old or when we talk to students, those three things: discern, resist, and find community. Because we can talk all day about who caused it and what the problem is. But the three things you just mentioned are the things that are what we're going to need to do.
Yeah, thank you. Thank you, Marlon. I really appreciate it. That's it.
Alex, thanks so much. I want to have you on again. Seriously, I think there's some deep dives we could take that actually would be interesting to people. And I'm sure we'll get some feedback even from this episode with questions. Thank you so much for your work, Alex. It's great to see you. I'm proud to call you a friend and colleague and look forward to continuing this work together.
Thank you, Marlon. Thanks for having me.
Welcome back to, or welcome to if it's your first time, Marlon Helps, or at least tries, our Q&A segment where we ask Marlon questions and he answers them. Producer Andrea will be joining us for these Marlon Help segments, so she is on mic with us today.
Hannah, producer Andrea, great to be here.
Gang's all here.
The question this week is, why are schools so crucial as a center for mental and physical health support?
I think for most people, there's nothing more dependable if you're driving across the country on a road trip, every community over a certain number of people, it's going to have a school or something, that approximates a school in that community. And in a lot of ways, it's the only real and like consistent safety net that we have in this country that until now anyway, most people have agreed that taking good care of our kids um, is something that's going to continue to build our society in the way that we want it to and grow, uh, healthy next generation. I don't think there's anywhere you can go and just consistently, if you can't afford it, get free food or, hopefully, theoretically, have someone who cares about you, even if no one else does, because we live in a world where not all kids are cared for. So, compulsory education, making kids go to school and providing that physical spot for them that's not, you know, either what could be an abusive household, could be a great household, but also a place away from parents. Um, I think it just seems like an obvious idea of any developed nation should try to do. So uh, that's, I think that's the lowest hanging fruit we have is public education.
Schools being the center.
The center of the community.
Yeah. It's something that I didn't really ever think about until the past several years. I feel like especially pandemic and post-pandemic, there's just been more awareness and attention around that. And yeah, it makes so much sense to me. So I'm glad that you're able to explain for anyone who may not be familiar.
Well, I think it just makes sense too. Like, you drive through different neighborhoods and it's a building that hopefully is like not in horrible disrepair. It's a feeling too, because if everyone coming together in a world that is so separated, we still have kids of Democrats and Republicans or people really identifying with one particular political ideal. They're still going to school together. I mean, you see school boards, local control and the push for, kind of creating your own policies in your area that work best for you and for your community. Well, those are still some semblance of community. And actually, it's probably the most important form of local government. Not to all you city council members out there. I mean, a lot of that stuff's pretty boring, so no offense. But, I think it matters more as a parent. I'm much more concerned with who the school board is and what decisions they're making for my kids, what they're going to learn, what they're going to see at school, and how they're going to. There's no way to just teach students as brains in a classroom. You're always teaching them how to be human.
Something that's come up more than once and I'm always struck by when I'm listening to you to talk to all these brilliant, thoughtful people is that fact that outcomes across the board are improved if a child has one trusted person in their life, like outside of their immediate family, I think, that they can count on.
Mm-hmm.
And it feels like I always wonder, like, where would that person be? And then I think probably a teacher. And then maybe this is the East Coast in me. I don't remember thinking of my teachers as like trusted individuals. I didn't not trust them, but it wouldn't have occurred to me. And so like, I think we have a lot of educators who listen, and this is a lot of setup. I also know that teachers are already overworked and don't have a lot of time and aren't really connecting one-on-one with students. So is there anything they can do to sort of foster that that trust really quickly or like at scale? Yeah. I don't know what you know what I mean?
I think there's things they can do in the classroom to not erode that trust. I think creating even good classroom management and being, even-handed in what deserves like discipline in the moment, what doesn't. I really like, there's a book called The Nurtured Heart Approach by Howard Glasser. Actually, it's the Nurtured Heart Approach, I think, is just the theoretical orientation. And the book is like the challenging child, or there's one called the Inner Wealth Initiative, too, that's just for teachers. But that whole idea of giving energy in the classroom to behaviors that are sort of helpful and social and foster learning, and sort of holding back on the emotional connection when it comes to behaviors that are unhelpful, because a lot of times what kids are looking for is just any kind of reflection back from an adult that they matter. And they'll often, just like as adults, and as the internet is proof of, we'll take negative attention over no attention. So I think, teachers in the classroom, what I've seen a lot of teachers change lives and be a trusted adult simply by modeling, even enforcing the rules in the classroom, valuing each person, like reflecting their value as a human being back to them, no matter what they're doing or how they behave. It's hard. Being a teacher is one of the hardest jobs you can have. It's being a good teacher, I should say, is one of the hardest jobs you can have.
Totally.
I'll say one more thing. If you look at Maslow's hierarchy of needs, safety, emotional safety, those are all basic needs along with food and water. And then it's actually, you have to get a lot of those needs met until you get to sort of the middle of Maslow's hierarchy. Achievement's somewhere around the middle. Self-actualization being at the top, just sort of like the idea of being all you can in your lifetime. But schools bring us to that level, hopefully, where we can feel safe, learn how to talk with each other, and learn how to achieve. Because that's not just a given. If you don't have a safe place and you're worried all the time, or if your neighborhood's a violent place, it sort of takes away from schools and the safety that they provide, the emotional safety they provide. But I think the good news is, for the most part, whether you're on the more conservative side or the more liberal side politically, for the most part, people want to take care of and keep our kids safe. They don't always have the same ideas and why they're doing it, but I'm hoping that we can continue to agree that schools, public schools, are the one thing that we still have, that it's a place we can all come together. We've agreed, even if it's just for our kids' sake, that we're going to come together and we're going to take care of all the kids until they can grow up and have their own kids and thoughts and lives.
Yeah, definitely. Thank you for your knowledge on this. And I think that your expertise is really important in this space and hopefully will help other people.
Well, I like being able to be here and talk with you all about this stuff. And it helps me too, because I'm like hearing, even processing what I think and why these things are important.
Yeah, totally. All right. We'll see you next time. I keep wanting to do this.
Do it.
Whatever you do it all the way. Really, as in the words of Judd Apatow, the notes that he gives his daughter before she goes on Broadway, all he says is, ham it up.
Pretty
Which at first I thought was like he was mailing it in, but he is Judd Apatow, and he has made the funniest movies of our lifetime.
They are kind of hammed up.
The guy hams.
Yeah.
No one hams like that.
He's a real ham guy.
Yeah. Ham it up. Hannah the ham.
Hamma.
Ah, there we go. Hamdria, Hamma, and Hamlet. Marlon Morgan. There we go. I got him.
That could have been my nickname as a fifth grader. I could not.
Leave him alone.
I could not get enough sweet Hawaiian rolls, mustard, mayonnaise, and a big piece of ham.
That is ham. Delicious. I'm obsessed with those things.
Honey baked. More ham. More ham. More ham Morgan. Old Moreham's coming. Thanks for joining us today. We hope it helped. Stay connected with us at thishelpspodcast.com.